The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning to one of the greatest cities in the United States, Philadelphia. Good morning, good morning, good morning. Oh, do we have a great show for you this morning? I got to tell you, we've already actually got our first text in, and show hasn't even started yet. But hey, this morning's show, we're going to be talking about testosterone and hormones, and we have got the greatest expert. Let me introduce you to our monthly expert, Katie Harris. She owns the Philly Wellness Center. Good morning, Katie.
Good morning. How are you?
Doing well. God, we already got our first texter ready, but before we get to that, let's tell everybody about Philly Wellness Center.
So Philly Wellness Center, it's on 8th and South. I do hormone therapy, regenerative therapies for pain, and weight loss. So it all kind of runs together.
Yes. Well, it's we got our first question already, and it's from a mother of a 16-year-old. She said, I saw where this show was going to be airing this morning. I had to tune in. I do have a question. I had been told that my 16-year-old son might have low testosterone. I thought you had to be older to have low testosterone. Can you talk about that?
Yeah, I mean, so we're seeing it more and more and in earlier and earlier ages. So there could be a couple of reasons there. There could be a functional issue, right? So there could be a reason that he's not producing testosterone that's hormonally based, that there's a lot of physical reasons, biochemical reasons that would need to be tested. But what we're seeing kind of in older men in their 30s who are having low testosterone, a lot of it is environmental triggers. So the plastics, the toxins that we're taking, just inadvertently, obviously we're not trying to take toxins, but everything that we're taking in, those environmental triggers are causing decreased levels of testosterone. And as you also gain weight, you produce more and more estrogen, and that comes from your fat cells. So that kind of starts overtaking testosterone levels as well. So he can definitely have low testosterone for a bunch of functional reasons that would definitely need to be worked up.
So 16 years old could absolutely possibly have low testosterone.
Yeah, and we actually had a case, one of my colleagues, where the kid he was like about that age, 17, 18, and he was acutely suicidal, and they could not for the life of them figure it out. And they discovered that he had really, really low testosterone levels, like under 100. And when they did replace testosterone on him, he did really, really well. But there's lots and lots of reasons that need to be worked up.
Katie, she just did a follow-up. What is your phone number at Philly Wellness Center?
It's 215-709-9710.
9710?
Yes.
Okay, very good. I'll have also Rebel make sure I put that up there also. So, there's so many, Katie, there's so many people who have no idea about hormones and how they affect you and testosterone. What is testosterone's role in, like, for example, in men's overall health, and why do their levels drop over time?
Yeah. So testosterone is really, really important in men and women, actually, and it helps you with energy. It helps with metabolism. It keeps your metabolism up. It builds muscle mass. You can't build muscle without testosterone on board. It helps with mental clarity. There's receptors all over the body for this. It lifts your mood. So in men and women, we see, I have a couple of patients that were referred to me from a clinical psychologist, and the patients come in and they're getting all this therapy, and I do testosterone, and all of a sudden they don't need their therapy anymore. But it's not always the case. But she did call me and she was like, "Oh, I've lost the last couple of patients that I sent to you," and I'm like, "Oh, sorry about that," but it will increase bone density as well. And of course, everybody knows testosterone for sexual health. So it'll increase libido, and increase sexual drive as well. So your levels will naturally begin to decline around the age of 30. And that's just a factor of aging. They will decrease about 1% to 2% per year, but that is getting more and more accelerated by things like stress and poor sleep and the weight gain and the environmental toxins that we're being bombarded with.
So those are all symptoms of low testosterone.
So low testosterone can show up as fatigue and low motivation. I had that at one point where I could not get off the couch. It was just completely like unmotivated to do anything, even to like make dinner, which I can't do because I'm a single mom. I can't not be motivated. And when I replaced the testosterone, that changed everything for me. I found my mood was lifted, the motivation was back. It will help with if you have brain fog, again, reduce libido, weight gain, because it increases metabolism. It'll speed up at the rate at which you use the energy and help you to lose weight. It will help with erectile issues. And like I said, if you have depression or irritability, it could be testosterone.
So tell me, like, what labs do you look at when you're diagnosing low testosterone?
So we like to look at total testosterone and a free testosterone, and the lab values that you'll see. So lab values that are out there are kind of a moving target, and they change with the population as the population changes. So what is considered a normal testosterone in the functional medicine world, we consider extremely low testosterone. So a level of 300 to 1,000 is supposed to be normal. We consider normal 1,000 plus. So it's a huge difference, but that curve, it's under a bell curve, and that curve moves based on the population. And as the population's testosterone levels get lower and lower, the normal lab values get lower and lower as well. So it moves with the health of the population. So it's not normal is not optimal all the time, and a lot of times we find that it's not. But we'll also test DHEA, which is a precursor to testosterone. And that's actually an over-the-counter hormone. I don't know why some hormones are over-the-counter and some are like testosterone's a Schedule 3, but that will convert into testosterone. And then we like to look at thyroid markers. And in men and women, if their testosterone is extremely low, we'll look at LH and FSH, which are associated with women as hormones of reproduction. But men have LH and FSH as well, and we look at those if the testosterone is really, really low.
Teresa in Philadelphia just wrote, I'm so glad there is a show like this. What kind of creams do you suggest for women with hormonal problems?
So, I mean, we would base that off of your levels, but you want the estradiol cream for, to help increase vaginal lubrication. And also we prescribe testosterone cream for women at a special dose. Obviously, you're not going to get nearly as much as a man, but
Right.
the testosterone, I mean, it's amazing. Of the two, I think I'd almost rather have testosterone than the estrogen because it's like amazing. But if you're having hot flashes, you might have a different opinion of that.
So the testosterone replacement therapy, how does that work? Is that an injection? Is it a pill?
Yeah, there's different ways to do it. We try and steer away from pills. The estrogen pill, I mean, that would only be for women. Has a very, very low but real risk of blood clots. The other methods bypass the liver, and that's the key, is to bypass the liver so it doesn't have to go through that type of detoxification. And so we will do testosterone creams. For men, we'll do testosterone injections, and then we do pellets. And pellets go under the skin. So we'll put them in the backside, make a small incision, and place the pellets there. I like that last option the best because it's the most consistent and the most stable. So when you put the pellets in, your blood capillaries wrap around them, and then the body uses what it needs when it needs it. And for men, they'll last about 6 months. So they don't have to worry about testosterone replacement until 6 months later. Whereas with injections, you give yourself an injection and you get this massive surge of testosterone, and it's going to peak and then it's going to plummet. And then, you have this constant peak and plummeting. And plus you have to inject yourself sometimes twice or 3 times a week.
Dr. Harris, I got to tell you, a friend of mine had the pellets done, and he said it made a huge difference. He said he was always tired, run down, and once he did the pellet, he said he felt like a new person again. Is it that much of a difference?
Oh, it is. And depending on what your testosterone level is and the free testosterone. So, I said we test both. We look at the total testosterone, and then free testosterone is the amount that's circulating around. And if that level is really low, then you're going to have issues with all of these different, the fatigue and the brain fog and I go to the gym and I can't build muscle type of issue.
Right.
And that happens a lot. So, and it can work pretty fast. I mean, I've had some people that I'm not kidding. Like I literally put them in and they're like, "Oh, I feel so much better." And I'm like, "Come on."
Yes.
But within a couple of days, the capillaries have already wrapped around them and the body's using it. It's like, "Oh my God, thank you for this testosterone." And it absolutely changes lives.
Yes. So it lasts about 6 months?
For men, it'll last 6 months. For women, it's 3 to 4 months. They need to be replaced because we use much smaller doses, and it's not going to last as long.
Can you do the pellets too much? Can you overdo it?
Again, the body's going to use what it wants when it wants it. So yeah, we don't have too much. There's not too many issues with overlap of that. So I mean, I certainly wouldn't do it every month or every 2 months, but generally the guys start to feel it wear off about 5-6 month area. And it depends on how active they are. I mean, if you're running, I have some guys that are running marathons every month and they're really fit and they have such incredible cardiac output that they're using up their testosterone much, much faster.
Are there any side effects to testosterone replacement therapy?
Yeah, like anything, there's some side effects, especially when you get that first surge. A few people will get an acne breakout, and kind of like when you were in your teens and you went through puberty and you got the surge of hormones. That first initial testosterone replacement can cause those types of things. But then it clears up, and if you keep a consistent state, it generally doesn't come back. The other thing that you can get is some water retention because over the course of a couple of weeks, as the testosterone is really it pulls water into the muscle. So that can be something that happens. So some people might have some mild bloating or ankle swelling when they first start. And generally it's that first surge of testosterone. And then men, we watch their red blood cell count because we don't want to see testosterone can stimulate red blood cell production, which can make the blood thicker. So if that's the case, we generally have men donate blood once a quarter.
There's so much out there on the internet. I would say there's a lot of misinformation out there on the internet. So there's concerns around, we'll call it TRT, testosterone replacement therapy, and prostate cancer. What does the evidence say about that?
Yeah, so I mean, there's been a huge fear of testosterone for many, many years. I mean, they used testosterone for a long time. And then in 1941, there was a study that was done with like a physician's own patients, right? He took randomly 20 men that he happened to be doing testosterone replacement on. And they had been castrated at the time, like for reasons, for medical reasons. And they were following their testosterone levels. And there was one guy that ended up getting prostate cancer, and a bunch of people that had fallen out. But the markers that they were using were really outdated. But there was that concern that because the guy had gotten testosterone, despite the fact that his testosterone levels were extremely low, which puts him at risk to begin with, that was the cause for the prostate cancer. And that one study has fueled an entire belief system in our medical world that testosterone is bad, it's not good for you, and that it causes prostate cancer. And it's crazy at some level when you think about, because nobody actually repeated that study, and they look at that study and quote it all the time without realizing how small that sample size was and how significant. It's done so much damage, and there's been dozens of large scale studies done now that have shown that there's no increased risk of prostate cancer with testosterone therapy. And in fact, what they've shown is that men with lower testosterone have the higher risk, and men with high testosterone never get prostate cancer.
So it actually can support prostate health.
It can support prostate health. Yes, absolutely.
Wow. Hey, Dr. Harris, does it bug you when, let's just say, someone thinks they have low testosterone? Because there's a lot of people who think that and don't ever get tested, and then walk into a GNC and take one pill. That would bug the hell out of me, because they have no idea what their testosterone levels are, and everybody's body is different.
Yeah. Yeah, I like to work off of data, like real objective data, and follow your symptoms, right? So I want to see some numbers, and they need to correlate with the symptoms. So if you came in and you're fatigued and your testosterone's like 900 and your free testosterone looks good, well, there's lots of reasons for fatigue, and those are things that we would go over. But yeah, you see influencers on Instagram all the time, and they're like, I did this one thing and it changed my life. And it's kind of like, well, great for you. But, that's, everybody's biochemical environment is different. And you need to take a hard look under the hood, if you will.
What's the average age of your patients?
So for men, we generally treat after the age of 40. So one of the things that giving exogenous testosterone does is that it reduces the sperm production in the body. So if you have really, really low testosterone and you don't want to have kids, that's not a concern, then we don't have any problem giving testosterone. But like the woman with the young boy, giving exogenous testosterone will shut down sperm production. Not permanently. You can come off the testosterone and it'll build back up again, but it could take a year or two for that to happen. So we generally stay away from men that are trying to have children with their partner or need their sperm count elevated.
Brandon in Philadelphia, great show. It's about time someone does a show like this. Tell me, how long, once you start on the replacement, do you have to stay on it?
Well, and I don't mean this to be a flip remark, but do you stay on it as long as your health is important to you? Because testosterone is very powerful. It cleans up your cardiovascular system. It cleans up your cholesterol system. It improves your mood and your brain functioning. increases bone density. So these things are really, really important, and you stay on them until, you can stay on them till you're 90 or 100. We actually have, some 80-year-old clients.
So does this help women who have osteoporosis?
Yes, it's better than any medication that's on the market, and it has none of the side effects that all of those others do, which, there's some really terrible side effects with the bisphosphonates. But testosterone will increase your bone density by 8% within like a couple of years.
And you said that how testosterone also helps influence the libido. Is it always is low testosterone always the problem that you find?
So yeah, I mean, libido is it's definitely a multifaceted issue, and for men, once you get your testosterone levels under 300 and under 250, then you can start experiencing erectile dysfunction issues. And so testosterone is one factor that will help improve erectile dysfunction. It's not the end all be all. It will increase desire, but that doesn't necessarily mean it will improve the erectile dysfunction, because erectile dysfunction it's really a biomarker of your underlying health. And we need to optimize the body to be able for performance, right? So there's other things that we look at. The penis needs blood flow in order to have erectile capability, and that's what Cialis and Viagra do. They expand the blood vessels so blood can go to the penis. But the problem is that it's not correcting the issue. Like, you need more blood flow. You need more capillaries going to that area so that it can get engorged. And sometimes you have blockages and plaques and stuff like that. So we use different capabilities like soft wave and radio frequency, which helps literally generate more blood vessels to the area.
First of all, I want to thank everybody who are texting in questions. We just got one on our chat line. What are the signs of, I think we've answered this, of low testosterone?
Yeah, so fatigue, low motivation, brain fog, reduced libido, weight gain, erectile dysfunction, depression, irritability. And again, all of those things can have many, many, many reasons. But if you're a 40, 50-year-old male and you're experiencing them, testosterone evaluation is definitely warranted. It might not be the answer, but it's definitely worth looking into, and it's an easy fix.
What non-hormonal factors can contribute to a low sex drive?
Well, I mean, so there's, I mean, if you're under a lot of stress and you have, it's very difficult. Your cortisol levels interact with the body, and with testosterone, and insulin levels interact. But I mean, really, stress is extremely powerful in how it affects us.
I also read that when you're under a lot of stress, it also affects weight gain. How do you deal with stress with your patients?
Oh, that's a good question. So yeah, it's definitely multifactorial. A lot of them just need the cortisol. If it's running amok, basically, it's one of those things that it can be somewhat controlled with hormone therapy. So we have men and women on progesterone, and progesterone is a hormone that we normally associate with women, but men have receptors for progesterone as well. But progesterone regulates, in a lot of ways, cortisol. So when you give progesterone, it's very calming, right? And even a progesterone cream, like if you have a hysterical woman that's in menopause and having breakdowns, if you just rub progesterone cream on them, they start to calm down almost immediately, right? And that's one way to do it. Obviously, there's other external factors, like if your job is stressful, you have a lot of toxic relationships, this is not going to be fixed with hormone therapy. This needs a deeper dive into like what's important to you in your life and how are you going to manage this.
Well, we're getting a lot of questions into the studio. How do you know if you have a prostate enlargement?
Well, you would have difficulty urinating. You might get up multiple times during the night. And men are going to certainly have increased prostate as you get older. But yeah, the urinary frequency is the biggest one.
Well, I got to tell you, your show goes by so fast. We had so many more questions for you. Tell people how they can reach you at your clinic.
So you can certainly email us at info@phillywellnesscenter.com or call us anytime, 215-709-9710. You can also text that phone number, or you can just go to the website and sign up for a consult if you want to talk more.
I'm sorry we couldn't get to everyone's questions. Dr. Harris will be back again with us next month. If you missed part of the show, you can go to iHeart or Spotify, and her show will be on there. In fact, all of her shows will be on there. Dr. Harris, thank you so much. I can't wait till next month for your next show.
Absolutely. Thank you.
Thanks a lot. We're going to go to break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.